Dr. Jill here. I want to go over a few forms we're going to start using more in the practice to help us with tracking and kind of to stay focused on the goals that we develop together. So the first form we're going to start using uh, more frequently is this functional medicine prescription and lifestyle plan. So we'll plan to go through this and once we do a annual well visit, then and have labs, then we can formulate what sort of functional nutrition plan we need, lifestyle plan, supplements, and medications. We're also, as needed, going to use the exercise prescription. You know, basically our goals in terms of risk assessment. We will go through these and this just reviews a little bit of like the intensity as well as what sort of plan should we be looking at for your general health. In terms of exercise goals and tracking, I know many of you go to the gym and have lots of ways that you track what you're doing, but certainly for anybody who needs some help with kind of tracking in habit development, those kind of things, these are really nice tools. Kind of goes through, what day, what sort of activity are you doing, what sort of intensity are we doing. So, and then kind of how you're feeling with that. Uh, there's a pretty neat form that I came across here from the Institute for Functional Medicine, and it's really talking about increasing movement with office exercises. So for any of you working in an office, this is super nice. Um, just gives you some ideas and different things you can do each hour just to stay active. Lastly, and some of you have seen this as it's been part of your living matrix in the intake. And so, really kind of getting an idea of what you're doing in terms of diet, nutrition, and lifestyle over 3 days. And so, the idea is just so that we can get a sense of what you're eating, how you're moving, your sleep, stress, those kind of things. And so that can help us then combine that with your physical exam and labs and all those things to really get an idea of where we need to focus or where we want to go. And this, you can see it talks a little about food and drink. So you can write down what you're having. Don't worry so much about the protein, fat, and carbs. You can put little X's by the red, orange, yellow, green, blue, purple, black, and white, tan, and brown. Like those are just making sure we're getting all of our different colors in our diet each day. And then cover sleep and relaxation, like how many hours of sleep, what sort of relaxation activities are you doing, exercise and movement, stress, what did you do for that day? What are your stress reduction practices, and what are the particular stressors? And then, a little bit of thinking about relationships, those supporting relationships and non-supporting. And so this really helps us get a total kind of picture of where we're each at mentally, emotionally, and spiritually. And so this form just repeats itself for 3 different days. So moving forward in the practice, we're going to utilize these forms. You can print them out if you'd like to look at them and use them as for tool to become more familiar. We will go through these. We'll go through uh, those that are applicable at your well visit. And I think this will be a really good tool to check in with at that kind of semi-annual visit as well. So, so those are the tools that I wanted to cover today. And I look forward to chatting with you again. Have a great day.